Welcome. My name is Gloria Johnson, and today I will be discussing racial and ethnic disparities in the utilization of mental health services among minority versus non-minority adults. Need characteristics: mental health. In the United States, approximately 61.5 million Americans suffer from a mental illness in a given year. At the national level, over 80% of ethnic minority adults had unmet mental health needs. According to the National Journal of Social Psychiatry, this is mainly due to the underutilization of mental health services by minority adults. Mental health needs can be identified as diagnosed under the DSM-IV, with the most common being major depressive disorder, followed by social phobia, anxiety disorder, and PTSD. Non-Hispanic whites consistently exhibited the lowest unmet need rate of 60.5% across the U.S., whereas minority groups such as African Americans, Asians, and Latinos had higher unmet need rates than the national average. Predisposing factors: racial ethnic characteristics. Spanish-speaking demographics are less likely to undergo a treatment service if it is not available in Spanish or with a Spanish-speaking physician. Cultural perspectives play a major role in how mental health and utilizing its services are viewed in the minority community. For example, rural African Americans in the South have a higher chance of living in persistent poverty compared to other groups, according to the Psychiatric Services Study. This population is far more likely to develop stress-related psychopathology, such as depression, which was found in 30% of the sample, compared to the 10 to 19% in other African American communities. Racial disparities research has shown that African Americans are at higher risk of experiencing disability burden related to mental illness compared to white Americans. With higher risk, there is also a lower utilization rate of mental health services among African Americans due to various cultural barriers. According to the Journal of Psychiatric Research, there is a general mistrust of medical care that have historically persisted among ethnic minorities that leads to a lower utilization of these services. In addition, the same study found that minorities prefer care from physicians that are of the same race or ethnicity that allows them to be more comfortable, whether it provides a more trustworthy environment or the ease of conversing in one's native language. Another factor to consider is the discrimination faced by minorities when utilizing such resources, which often are the source or reinforcement of their negative beliefs about mental health services. In addition, these discrimination experiences make it difficult for an individual to express their mental health issues to their family, as there is a fear of stigmatization that may lead to discrimination within their own peers. Predisposing factors: gender and age. According to the Springer study, adults under the age of 40 had the highest unmet mental health needs. Adults between 40 to 59 years had the lowest unmet need. In addition, men were found to have greater unmet need compared to adult women. Geographic location. Geographic location is significantly correlated to the racial disparities in mental health observed across the U.S. The most obvious contribution to geographic disparities are socioeconomic factors, insurance status, and immigration history. Secondly, the Springer study stated that the availability of specialty mental health professionals can differ in rural areas that are often highly occupied by minority populations. In addition, the implementation of mental health policies can lead to geographic patterns of unmet needs. For example, the Mental Health Parity Act of 1996 was a federal law that was implemented differently in each state, leading to geographic differences in how mental services were utilized by state. Enabling characteristics: insurance status. Ethnic minorities are more likely than whites to lack insurance. The 2014 U.S. Census Bureau found that 19.9% of Hispanic residents were uninsured. The lack of insurance is often due to the individual's socioeconomic status that discourages them from utilizing available mental health resources as they fear the cost. Socioeconomic factors and influence. For many, underutilization of these resources may be attributed to socioeconomic factors that affect an individual's access to mental health services. Lack of insurance, physical barriers such as lack of transportation, or even simple unawareness of these resources contributes to underutilization. Individuals who obtained a lower level of education were less likely to utilize mental health resources. Income. The Springer study found a higher unmet need rate of 0.90 for those with a household income between $35,000 and $74,000, in contrast to higher incomes. Individual health outcomes. With this underutilization of mental health services, minority adults facing psychiatric disorders have a negative effect on their health. As minority populations are more vulnerable to stress-related disease development, the strain on their mental health will lead to physical problems, such as increased blood pressure. Socially, Latinos and African Americans with mental illnesses will face the pressure to hide their disorder as it will be looked down upon by their community. Population health outcomes. The underutilization of mental health services by the individual will translate its effect to the population's health. This results in a lower overall population health among the ethnic minorities. Another concern is that this stigmatized behavior is reinforced in the cultural community, as it is a tough ideology to break. Efforts and progress. The Springer study suggests several national efforts to help decrease this disparity between minority and non-minority populations. This includes increasing the availability of mental health services and providing funding towards strengthening mental health care systems. The Psychiatric Services Study suggests improvements in telemedicine and quality of care in order to have a more acceptable treatment options. Under the ACA, the disparity narrowed for Hispanics and Blacks as more individuals became insured. Disparities among whites, Latinos, and Blacks decreased the most in states that expanded Medicaid. The coverage expansion by ACA allowed for increased access to care and reduced racial disparities. Discussion questions. 1. What are some possible public health interventions to change the cultural stigma towards mental health and its services in ethnic minority communities? 2. How can developments such as telemedicine change this utilization disparity between minority and non-minority populations?